Most families don't realize they're making one of the biggest financial and emotional decisions of their lives until it's too late. Today's guest is on a mission to change that. From senior placement to dementia care education, she's helping families avoid costly mistakes and find the right care. Let's dive in.
Welcome to From Leads to Leases, a CCR growth podcast that helps senior living providers transform their complex challenges into opportunities. Listen in for stories from industry leaders, innovative strategies, and insights. And with our expertise, learn how to increase occupancy faster, guaranteed.
Welcome back to another episode of From Leads to Leases, the podcast that dives deep into the senior living and senior care industries, bringing you insights, strategies, and stories from the experts at the forefront of innovation, leadership, and care. I'm your host, Jerry Vinci, CEO of CCR Growth. And for those of you who don't know about us, CCR Growth is a full-service marketing and growth agency that's exclusive to the senior living industry. Through this podcast, I'm here to guide you through the evolving landscape of senior care, exploring the innovations, the strategies, and leadership insights that are shaping the future of the industry. Whether you're a provider, a caregiver, or industry leader, this show is here to help you make informed decisions and create meaningful impact. All right, today we're joined by Jamie Slone, a certified caregiver with over 20 years of experience who founded The Right Senior Care Connections, a full-service advisory firm helping families navigate senior placement, long-term care planning, and dementia education. Jamie's unique approach goes beyond just finding a place for seniors to live. She builds comprehensive care plans, assists families with Medicare and financial planning, and connects them with trusted professionals to make the transition into senior care seamless. So in this episode, we'll break down why working with a local senior placement expert matters, common mistakes families make when choosing a community, and how to recognize the early signs of dementia and stroke. So Jamie, thank you so much for joining us today and welcome to the show.
Thank you. Yes, I'm so happy to be here.
Yeah. So I think first, just talking a little bit about going from a caregiver to senior placement agent. You've been a caregiver for over 20 years. And so what led you to transition from hands-on care to launching The Right Senior Care Connections?
Yeah, so loved being a caregiver, and I still have private clients that I see. The passion behind being there for seniors that don't have anybody has really led me to the position I'm in now. There are so many out there that don't have family even at all or family in town. And there's a lot of navigating and a lot of just paperwork that senior can't do themselves. They might have arthritis in their hands. They might not be able to see well. You know, some of them can't hear good enough to make the phone calls, to get information on places. So being their right-hand man and being pretty much an extended family member to them is really what has brought me to being able to guide seniors to the right senior living. It's been really important to me to be an advocate for these seniors that don't have a voice. And I think that's really what has driven me to starting my own company.
Yeah, I think just the whole process of placement is so challenging for so many families because it's the one thing that I think we all at some point expect we're going to have to do or we might have to do, but nobody really plans for it or knows how to do it until they're thrust into it, you know? So I think having someone like you on their side can be so beneficial to navigating all of those twists and turns that come up during the process.
Yeah, it's very often that these people, whether they're living in assisted living or they're living at home, there's so many different options that people do not know where to start. So even if you have family, I find that what I do is such a huge stress relief. I get all the time, oh my gosh, we never would have found this place without you. We couldn't have done this without you. You know, the gratitude that I get from these family members is, you know, says it all, just how hard it is out there until they realize that there is a placement. Like, you do this and it doesn't cost me anything. It's like, oh, this is what I do. It's amazing. And people are actually, it's sad because a lot of people don't know that we're out there. And so hopefully we can get some more notice that there are placement advisors out there to help families, you know, and it is a free service, which is nice.
That is nice. That's amazing. And you've mentioned too before that senior placement wasn't just a business, it became a calling for you. Is there a particular story or experience that solidified your passion for helping families find the right senior care solutions?
Yeah, you know, there's quite a few, and honestly, I can touch on one that I have currently. This lady, she's 90 years old, and she is attached to her things. Her house is falling apart. And no matter what her family has suggested, she still thinks that she wants to stay at home. So when I come in, it's a lot of getting to know her, getting in her headspace, and trying to adjust or help her adjust to the thought of, moving and selling her things. And so, yeah, it's so much more than a job. This is somebody's lifeline. She's been there 60 years in that home. All of her memories are there. She is in a place where she doesn't really need physical assistance, but the house is not safe anymore, and she has no money. So it's a passion where I can see a situation that is just unhealthy, and she lives on literally, this month she had $17 in her account. She could sell her home and move into an assisted living and live for the rest of her life comfortably with no stress. She doesn't have a wash machine. She doesn't have a dishwasher. She's 90 years old. And so for me, it's not about, oh, where can I put you and what place is even the best for you or what do they offer. It's more of like, let's get you some peace of mind. Let's get you out of this stressful situation into a safe place. And a lot of the time, you see their life change for the better. A lot of people think, oh, I don't want to put my mom here. I don't want her to go to a nursing home. Nursing homes existed in the 80s. We don't have nursing homes anymore.
Yeah.
We have communities that are filled with life and laughter and fun. And so many of these places, even the residents can lead groups and education and crafting. And, so it opens a whole nother world where she's at home alone right now. And that fear of letting go is kind of where I come in to try to just really ease that. But yeah, the passion really comes behind seeing that lady move into this assisted living and have all of her stresses relieved, and to be in a safe place and taken care of. And that just brings me so much joy. And I often stay friends with my clients. And I just actually was on a tour this morning, and I told her, I said, you call me for anything. She's going to move 5 minutes down the street from me. And she thought, really? And I said, yeah. I said, I'm invested. I'm with you for life. I'm a caregiver at heart. So, it's not about making good money or anything like that. It's truly about being a part of these people's lives and really showing them kindness, and that there's services out there for seniors and getting that awareness out. So, that's what I'm doing now.
Yeah, I think what you said too about nursing homes is so on point. There's so many people who still carry that stigma around that senior living is all nursing homes and it's institutionalized. And even us as a marketing agency, that's a big part of what we're doing, is trying to reshape that narrative that these are homes. This is not an institution. It's not a hospital setting. This is where somebody calls home, and we make sure that, these communities are set up that way. So I think that's such an important piece for people to learn early on in the education process of placement.
Oh my gosh, yeah. I hear it all the time. I just had this man, I had a perfect place for his mother, and he talked her out of it. Now she's moving in with him, and it's not going to be a good situation. And it's really sad to me because he really thought that it was going to be a nursing home. He never even went there to check it out. And so he used the word institution, and it's like, well, I don't know about those. I don't work with institutions or nursing homes. These are really great places. It's that, yeah, we need to get the word out that, exactly what you're doing is great, because you're informing people like, hey, these places have a lot to offer, and they're not nursing homes anymore. So, yeah.
What about getting your clients change ready? Because I know that's such a big part of helping people transition, is getting them on board. A lot of people are hesitant in the beginning. Family members might be pushing back or objecting to certain options or certain ideas that you might have. And how do you get people from saying no to saying yes?
Yeah, there's definitely a process. I first will meet with the families, meet with the client especially, and just get all of their needs and wants and fears written down, and then we go over those. And then I make it a fun time. I always say, and I work with a lot of women. It seems that women live longer, so I have a lot of, elderly women that I work with. Once I sit down with them and answer all their questions, then I say, let's make this a fun time. We're going to go out, we're going to tour, we're going to have free lunches, we get to have a girls' day, and the first step is just visiting, because once you visit these places, 99% of the time, I get the response of, oh my gosh, this is what I get for this price, and wait, that comes with it, and they have this here, and it's so beautiful, and everyone's so nice. And so just getting to go and tour with someone that's fun and relaxed, and we're going to have a good time and a free lunch. And then from there, we really have to break down what you're paying for. What are you stressed about at home? What's going on that is over here? And then when you move into the community, all of that's gone. Look what's all included. And so it really starts to turn wheels, and people start to realize, oh my gosh, everything I believed or was afraid of is answered for me. And I really so I specialize with memory care. And what I do with families is I will meet your family member and we'll go and do an activity at the community. We'll have a lunch another day. We'll come back for another activity. Get them familiarized, because it is awful for a lot of, I shouldn't say awful, it can be very traumatizing and confusing to just drop somebody off. And so a lot of times, to make families more comfortable and the client, we'll go and visit. We'll meet the caregivers, We'll take time. We ease into it. I'm not rushing anybody into anything. And that's, I think with me being a private caregiver for so long, is I'm really good with families. And I'm not in a hurry to make $1 off of you. If it takes 6 months for you to move, which is actually the situation with the 90-year-old, I've been working with her for 6 months. I've fixed her car. I've gotten her a free phone. I've helped her fix her TV. So I'm like, Carol, you can see that I'm a good person and I'm here to help you. And so once they realize that you're not some shark out there because I tell you, seniors are getting scammed so often that usually there's a wall up, and I have to break through that wall first. And so connecting on that personal level is key when you're doing this. This is a life-changing event and very hard for families. These families that are involved in care, they feel really bad about doing this. And I have to tell families all the time, their quality of life is going to flourish there. They're going to have more quality of life. Moving them into your home sounds like a great idea, but being a caregiver for your family member is exhausting, and you take away being a family member. When you are in a community, you can go and visit, you can have lunch, you can spend the night, you can do whatever you want, but you don't have to worry anymore. You don't have to be the caregiver. And that is so huge for so many people. They're so burnt out, And also with me, I have a lot of resources. So there's a lot of different programs in Arizona, especially to help you pay for senior living. So with me as a senior advisor or senior placement advisor, I bring all that to the table. I look at every angle to help these families be able to afford, the senior living.
I love what you're saying too about just getting them out and getting them, to experience these communities, take them out for free lunch, things like that. I think that's why so many communities push people to schedule a tour, because once they see the community and they get to experience it firsthand, I think that completely changes their perspective. The close rate from tour to move-in is so high because people absolutely fall in love once they see most of the communities. Yeah. There's obviously ones that don't get it right, but for the ones that do, it's just such a great experience for the older adults that are going on tours. Yeah. Obviously, the families don't realize often how overwhelming the senior placement process can be. What do you think are some of the biggest mistakes that people make when choosing a senior living community?
So I think the biggest mistakes that people make is not seeing enough places, not knowing your options. Don't pick the first one that you go into, because they all are different. And also, you really want to make sure you're researching. There are websites that show you whether they've been lit up. And another reason why you should have a placement advisor is because we can go to those websites, and I keep track of these kind of things. So if you're going to be looking at a place for your parents, it's just like buying a car. You're going to look at your options. And so definitely don't choose the first one that you see. Get to know the place. I don't care if the staff or the front desk is the nicest people you've ever met in your life. That doesn't mean that the community is right for you. Do some more research, because oftentimes maybe you do make that mistake, and then the trauma of moving the seniors over and over again, the money that it takes, the time, that alone, save your time. Call a placement agent and have them do that research, and I think that's the biggest thing is research, word of mouth, ask around, ask people when you're there, how long have you lived here? Because how long have you worked here? Those things matter when it comes to communities. If they have a big turnaround, that's telling you something. So there's a lot of different little things to look at for sure. And again, I think that's why it's so stressful for families. And so where we come in as placement advisors, we take all that away for you, narrow it down for you. And of course, me being a caregiver for 25 years, I've worked in so many places here in Arizona, and there's wonderful places and there's places that I wouldn't recommend. And so you get that with me. You get that experience, with me. me. And I love that. I love being able to offer that to families.
Is there a particular process that you use when you're vetting a senior living community? Do you have like a specific checklist and you go through that checklist the same way every time?
Kind of, yeah. I mean, again, because I'm a native here in Arizona, so I've been a caregiver for 25 years. I did private care, but I also worked in many of the communities. I was a med tech and memory care all over the state. So for me, I already have my checklist in my head, but it really depends on the person. I think food is a major factor. I think that you absolutely should try the food, because if you don't like the food, you're not going to like where you're living. So there's those checklists. If a person isn't really a big eater and they don't really care about the food, then that's one thing. But yeah, my checklist is going to be whether I look on the websites to see how they're recommended, what their reviews are, if they've been written up and what for. And then I'm going to decide, of course, with your income. And so then we're going to go down that route of who's affordable, and we're going to expand that a little bit to where it's a little bit more and a little less of what you're looking for. And then I always ask when I'm going on my tour or interviewing directors is how long they've worked there, how long their caregivers have worked there, because that really is important to me, to have a really good staff. Because if you don't have good caregivers, you don't have a good community, period. So that's where I start, really, is when I go and tour by myself, as I'm asking about the staff, I'm asking about the cook, I'm asking about the housekeeping, I'm checking to see if rooms are clean, but also how long has that care staff been there, and how invested are they, how much trained are they? So those are really important that people never think about. They think, oh, well, they work here, they must know what they're doing. That's not always true.
Yeah, we hope. Hope so. One of the other things too that I've seen, and I guess I've seen a shift in this space, is there's a lot of communities that are working with the national placement agencies like A Place for Mom and Caring.com. I want to say not so much as there was, because I think that their reputation precedes them now, and there's a lot of people that are seeing it's not worth it. These placement agents are sending referrals to 20 other communities, and it's flooding their system with a whole bunch of unqualified leads. I mean, what are you seeing on your end? I mean, why do you think communities start there or go that route as opposed to working with a local placement agent?
I really don't know the answer to that. I don't know if there's something that they have, some kind of an agreement. I think that A Place for Mom, I think one reason probably is because they are so big, and they'll promote your care home on their site and things like that, which, I'm private. I started in the living room of my house and with all of my knowledge and stuff. So I don't have camera crews going and filming your facility. I take you there. I think that's more personable. It is, So I think it's easy for them. It's easy for them to go with a large corporation, and they're going to take over and do all that. But they don't remotely even come close to the personal care. And like you said, as soon as you put your name and number in there, you're getting 500 calls a day for senior living. I don't even give my phone number. I won't give my client's number unless it's like a certain situation, because I don't want you calling them. They don't want you calling them. That's why they're working with me. And people don't understand when they put their number in A Place for Mom, you don't get like a person, you're going to get advertising for what you need to everybody else. And instead of, it should be the opposite, So yeah, the big corporate ones, and I'm finding actually in Arizona, there's quite a few more placement advisors, and I think there's less and less people. I think that, like you said, their reputation is getting out there. So it's so much better to work with someone local for sure than someone on the internet. But so many people just don't know where to go, and that's the hard part about that.
I think the overall idea was good when it started, but it's just ballooned in size. I mean, they're representing over 15,000 communities and have 400 to 500 agents nationwide. How do those 400, 500 people even know everything there is to know about these communities? Especially if you're in a very specific local market, you're going to know every single community in your area. You're going to know who the executive director is. You're going to know who the activities coordinator is, all of that stuff, what their meal plan looks like. I mean, you have such inside information. So I don't know. I'm not sure what the appeal is either for on the community level. I just think it's the sales teams. Honestly, I think they're lazy. I think it's an easy way for them to get leads through the door. And I think they have a quota that they're trying to hit. And if they can just say to Place for Mom, let's put our community up there and we'll just rely on them for leads. And they're just going to feed us leads, whether they're good or bad.
Right.
And they just go with that. But yeah, it's just, there's no way that those are converting at all for them.
No
so
way. And,
Yeah.
I have a lot of people that have gone through them and then work with me, and there's just such a huge difference.
It's interesting too. I mean, when I went to the Smash conference in October of last year, A Place for Mom was there, and 80% of the people at the conference were directly tied to a senior living provider. They were either activities coordinator, executive director, operations manager, and nobody had anything good to say about them the
Wow.
entire time we were there. It was almost like, why are they
Yeah.
here? And it was very interesting to see Place for Mom. Not only is their model messed up, but they've also increased their fees, their percentage that they take. It's more than the first month's rent now in most
Wow.
cases. And these communities are just hand over fist. They're not even
Yeah.
profitable to some degree for the first 3 to 6 months.
Yeah.
So it's a crazy
Yeah, it
situation.
is. It is. I hope that goes away soon.
Shifting gears, I know you deal a lot with dementia and stroke symptoms. So you're an expert in dementia care and Alzheimer's education. What are some of the early warning signs that families should be looking for when it comes to dementia?
One of the main things that happens is emotions. You will find that the emotions are out of whack. They're angrier, they're depressed, they're not eating. It really does start. I'll hear a lot, well, I don't know what's wrong with my grandma. She's been biting my head off lately, and she's yelling at us all the time, and she's never been that. And I start thinking, I wonder if there's some dementia going on. And, it's because I think people start realizing that they're losing some memory, and they're not able to complete tasks like they were before. And so obviously that's part of the dementia, but I think as a human you start noticing that yourselves, and your emotions are all over the place. You can't even control it anymore because your brain is, taken over by this disease. And so a lot of time it does start with emotions and behavior. You'll just start seeing odd different behavior. Not just people think it's, oh well, she doesn't forget stuff all the time. It's not necessarily that you're forgetting things. It starts a lot of time with the behavior. So, and that's one thing to look out for. And then of course, obviously, memory and things like that start coming into place. But I had a client recently, they said his mom probably had dementia for 6 years. The doctor had said that before she was diagnosed, and they thought, oh my gosh, that makes so much sense. So, it's good if you start seeing early signs, go to the doctor, because now they have medication that does help. And I'm all about natural things too. There's a lot of supplements out there that are helping brain health. So get to, research. Again, I just can't tell you how much research in this industry is important to find the right information for that kind of thing. So, and it's out there, and we're luckier. I'm on the committee of the Alzheimer's Association, and we raise money every year for the walk, and I'm very involved in that. And it's exciting that they have some new things that are helping with dementia, because it's such a sad, horrible disease, and very, very dear to my heart.
Yeah. It's interesting that you say behaviors and emotions too is one of the first telltale signs. Just because anger, for example, there's always something behind anger, right? You can be angry, but you're angry because you're scared. You're angry because you're frustrated. If they're experiencing these blips in cognition, right, and they don't know why, it could be scary, it could be frustrating, it could make them just lash out against people because they don't want to, I think older adults in general are just bad at self-reporting. Yeah. So if they notice those things, they're not going to say anything to anybody. So they're just kind of like silently suffering the whole time, which is really horrible.
This last generation, these older generations before we get old, they're the toughest people I've ever had the pleasure of working with.
Yeah.
They are just
I believe it.
So hard to break. And these elderly women, just like Carol, for instance, she doesn't tell anybody anything. Her family doesn't know she has $17 to her name. And I'm like, why aren't you reaching out? And this is over and over again that I get these women that say, oh, well, I haven't told my son. So, I really just want to say, like, on a side note, check in with your family members. Ask your elderly family, friends, are you doing okay? What is going on? Because they aren't going to be very honest with you. They're tough cookies. Sure.
Mm-hmm. That's true. Are there any physical signs of dementia?
A lot of time you'll start seeing it maybe in their walk. And it really depends on how far. So you can have dementia for years. And like I said, nobody knows it until you're really diagnosed with the Alzheimer's. And often the dementia doesn't start progressing enough to where you're going to see it like in your walk or your balance and things like that. It really just depends. They're all so different. It really is just so different. But physical things that start happening are more like, maybe bathroom, you're having some bathroom accidents, you're not getting to the bathroom on time because your brain's not telling you. It's so incredible of just how it is. It's like, that you need to go into the bathroom, but your brain is not telling you. And so then it's embarrassing for them because they know they've had an accident, So those are probably more the first kind of physical things that I often notice. And then you'll see, maybe in your balance and stuff. But there's people with full-fledged Alzheimer's that walk just fine. So much of it is, mental, and it's hard to catch on to for a while. So, get to the neurologist and get those tests done because, again, early onset is easier to avoid progressing if we get to the doctor and getting on those meds that are out there, on time. So
Yeah. I asked that because my grandmother fell and broke her hip, and then next thing we knew, she was diagnosed with Alzheimer's. So I was like, was there a correlation between the two? And I guess, balance being one of the signs, if there's a physical reaction or response to dementia, that could be the case, right?
Yeah, usually starts with the balance.
Stroke symptoms, too, in older adults are often overlooked or misdiagnosed. What do you think are the key signs that caregivers and family members should be aware of?
There's an easy way to remember the signs of a stroke, and it's the word FAST. So F is for face. So if you're seeing some droopiness, and honestly, you can just say, "Can you give me a smile?" And you're going to see that they're not going to have an even smile. A is for arm weakness. So you'll have them raise their arms, and if they cannot raise their arms, there's a possibility they're having a TIA or a stroke. S is for speech, and that's a pretty obvious one. Have them start talking. If there's some slurred speech there, you need to think fast, and that's what T is for, is think fast and call 911. Get them there, because with a stroke, I have the saddest story. This exactly happened to my friend's grandfather about a month ago. He had Parkinson's. He told his wife he was not feeling good. He says, "I need to go to the hospital." He got to the hospital. They told him it was just the Parkinson's. He was actually having a stroke. He walked into the hospital, mind you. He walked to the home. The next day, he was physically completely disabled. He had a worse stroke when he got home. He is now on hospice. He couldn't feed himself. Physically completely disabled. And that was because they didn't think fast enough. The hospital didn't see the signs, and they could have really have helped him, because there is that medication that if you get there in time, I think it's within the first 2 hours, they can substantially help your symptoms to not progress. And it's so important for families to know. And also, you have to advocate. My friend and her family, so many people everywhere, I worked in a hospital for a long time, they think that doctors and nurses are the king and queens. You listen to them,
Yeah.
They know all. And that's not true. They're humans, just like us, and they make mistakes. And so you have to advocate for you and your family member. Number one, don't ever let a senior citizen or an elderly person go to the hospital by themselves. Ever. I don't care if the paramedics say you don't need to come. You 100% need to come. And two, when you're taking someone into the hospital and you feel and you know that there are signs that are not common or, that are not regular for their daily life, you have to advocate that. You have to tell them, look, no, this and this is happening and this is not normal. I want you to do this test. You don't say, can you? I want you to do these tests on my father, mother, grandma, whoever, before we're leaving. Because by law they have to, and you have your medical insurance, that's what you're paying for. You went there for help, and unfortunately they didn't do their job that day. They didn't even take a test on him. They didn't do an EKG, a blood pressure. They would have seen that he was having a stroke and saved him. And he was his wife's primary caregiver. So now they're both in placement. So it's very sad. So FAST is a very good word to remember and to help anyone that you see that might be having that situation.
Yeah. That's a good cautionary tale for sure. And I think, Stroke is one of those diagnoses too it's almost like an undiagnosis, right? It's like we've ruled everything else out. This is the only thing it can be. So sometimes if they're not doing enough testing, they'll never even get deep enough into that to even know that's what
Absolutely
it
not.
is.
Especially because
Yeah.
you can have a TIA and have very minor symptoms showing at that time. Most of the time, if you try to walk, you'll have some weakness in your legs and things like that. But often listen to your body and advocate. For sure.
Yeah, that's great advice. Talking about memory care too, how do you help families prepare for long-term challenges of memory care when placing a loved one?
Luckily I've had so much experience, and memory care was a place where I spent most of my time as a caregiver. The transitioning is really hard for families. It's probably the worst because a lot of people with memory care don't have a voice for themselves. But I really stay connected with my families, and so helping them transition into a memory care, we do a lot more visiting. I feel like, it takes longer. There's a lot more information that has to be gone over. We'll sit down and get a care plan down exactly what your family member needs when you work with me. And then we're going to make sure that they're implementing all of that. I'm their advocate to make sure that these communities are going to be able to attend to all of their needs. But when finding a memory care, and I'm really excited here in Arizona, we've got some really great developments here where you're not just in part of the building anymore, and there's actually communities that are just for memory care, and they're free. You can walk and go as you want.
That's great.
Yeah, and it's so important for families to really just be so careful when you're choosing memory care, that you want a place that has qualified dementia trained caregivers, not just people that have been caregivers. There are so many people that cannot handle dementia or Alzheimer's patients, and they have no business being in that field. So you have to make sure that they're trained correctly, and you want to make sure that you have the availability to come and go and see your loved one whenever you want. When there's cutoff times where you're not allowed to come in the building, I don't like that. You should be able to access your family member anytime. They should give you the code to the building. I've been in places where they don't give the family member why not? They should be able to come in and whenever they want. So there's a lot of things that come into play when choosing the safe one and transitioning over. And then for long term, I just provide a lot of education and a lot of support. Again, when you work with me, I'm there for life. So if you want me to go and check on your loved one at the place that we've sent them, I'm more than happy to do that, and to make sure that all their needs are being met. And if they're progressing, then we're going to talk about end of life and all of those things. I have my company built to where I've got all of those resources. I have education for support groups and education and all of that, because it's so important. This is such a life-changing event for people. I can't say that enough. Traumatizing, and families it's overwhelming. So definitely get advice. Don't look for memory care on your own. Please get a placement advisor. I can't say that enough.
I agree. No, it's great that you have a team set up, because there's placement agents obviously out there who are literally just finding, a community and then that's it. We're done, But I do think that the majority of local placement agents do really put in the effort to make sure that people are happy, they're healthy, and that if there's anything they need along the way or down the road, that they're there to help support that individual. So it is, it's like a partnership.
Yeah,
which
and
is
providing
great.
education for these families and support groups is huge. And so I'm really trying to get more and more involved in that here in Arizona to have those resources.
I know you did mention that too, that there's some free events and workshops that you're organizing to help families plan ahead. Can you talk more about that?
Yeah, it's going to be exciting. I'm part of the Oro Valley Chambers of Commerce now, and we just started a senior service committee. And so there's a lot of us, people that do reverse mortgages, people that will help sell your home. And these are really passionate people about seniors. They're not just out there because they know seniors maybe have money, or they think seniors have money. Most of them don't. So yeah, we're gonna get in front of seniors this year, talk about scams and fraud, also the myths and the fears of senior living. I want to get the word out there that these are not nursing homes. That these are really great places where your family can thrive, and get a lot of education out there on different programs and resources. I personally will help find financial outlets for you, whether it's the VA, there's VA aid and assistance that so many people don't know they have. So, I mean, that right there is huge. Arizona has a long-term care program here. It's Arizona Long-Term Care, which will help pay for facilities. So we want to educate our families and our seniors here about all of those things and how important it is to plan ahead, because there's so many times that even with my little 90-year-old Carol, I was explaining to her, you're fine right now, yes. What if in 3 months you have a stroke or you fall and break your hip? Then you're at the point where you have no choices. You have to move quickly. Most of the time the hospital is giving your family a list of the homes that they recommend in town and the rehabs. You are in a situation where you're not able to make the choice for yourself anymore. Then it becomes a burden to your family. And seniors don't want that. They don't want to burden their families. So the importance of planning ahead is huge. Get to some senior livings. Even if you're not ready, tour, have a free lunch, see what they offer. Start planning for the future, even if it's from 5 years from now. Get on waiting lists at some of these amazing places because the good ones go fast. You might have a surgery that's coming up. I also want to educate people, get caregivers to come to your house. Plan ahead with that surgery so that you're not at the hospital going, oh wait, I'm not allowed to go home by myself? Oh wait, I have to go to a skilled nursing for how long? Plan ahead. Get your will and your POA and your estate planning. My company, I have all of that there. Resources for individuals, the financial planner, the fiduciary, everyone. I have movers that will come in and move your things and pack your things. And these are all dedicated, passionate senior, people that are really truly there to help. And it's just so important, the planning ahead. I mean, that's honestly, I probably wouldn't have a job if more people planned ahead, because they would, but
They'd have it all figured out.
Exactly.
Yeah,
but I think even with planning ahead, you do need someone that has the knowledge of all these places. But yeah, it's so important. So many people wait till the last minute, and then you're screwed. You're at the fingertips of the healthcare system, and that is scary.
Yeah, I think anytime you're kind of just sitting and waiting for something to happen too, it's like anything that can happen will happen. So no matter how, even the saying goes, even the best laid plans. I think it's one of those situations. You can plan all you want, but there's always going to be those outliers that you're not thinking about.
Family members that have seniors, they definitely need to look into starting to, I would say 70 or 75, let's start getting into the discussion of the future.
Yeah. I just came back from Washington, D.C., and I was there to talk with leaders in senior living about the policies that are going to help shape the future of senior living. And two of the things that we talked about quite a bit, we were really focused heavily on assisted living. And we were talking about the VA and how the VA doesn't cover assisted living. It has a pilot program right now to cover in a very small area, but 45% of residents in assisted living communities are either veterans or their spouses. Mm-hmm. So I thought that was really interesting, but yet their only options to be covered by the VA is to go to a skilled nursing facility. And I think that's a problem, because so many seniors are going to end up getting too much care, too much treatment that they don't need, and they're going to end up declining physically and mentally because they're in a facility that's not really giving them, the lifestyle that they really are craving.
And so many skilled nursing, I'm sorry, but there's a lot of bad ones, and they don't.
Yeah, there is.
It's because they're short-staffed, and so many people at skilled nursing need a higher level of care. So, and there's just no caregivers. There's no CNAs anymore because they don't pay you well. So nobody wants to do it. And then they're overpopulated with patients. So when you do go to work for very little money, you are working so hard. So it's not really the community's fault necessarily. It might be a great community, but they just don't have enough help. So you're not going to get what you need at those places, first and foremost. But yeah, it's really sad that the VA doesn't have more programs for our vets. That's another place in my heart. I have a man that helps me. He's my Medicare guy, and he's a retired vet and police officer, and he actually started doing his business to really help seniors because he saw so much neglect and just so many bad situations out there. So yeah, I mean, it's so important that you know where you're going for sure. But for the VA, there is a thing called the VA aid and attendance, and there are some individuals out there. Do your research, because the VA doesn't do it for you. They will not do it for you. You have to find somebody else that does it for you, and the paperwork's hard. But people don't know this, and I don't know if you know this, but if you are a certain age and you were active in one of those wars, there's a few $1,000 that they'll give you for assisted living, the spouse, or even if you're widowed or whatever. So, I mean, it's out there, just you got to do your research.
Yeah. Yeah, they're certainly not going to offer that up to anyone. So that's unfortunate. Yeah. And then even like Medicare and Medicaid, I mean, there's some states that Medicaid doesn't cover assisted living. I think there's 4 states in the United States where that's not the case, which is pretty hard to imagine, if somebody can't afford private care. I mean, their only option is a skilled nursing facility. Again, it's, they're so limited.
We're lucky here
I know
with Arizona long-term care. That's an amazing program. It is kind of hard to get into. You do have to have no money and you do have to need help. But usually when you're out of money and in that situation, you've gone through all your resources and you're probably at that point of your life now. And I have no problem helping. I love to be able to help people find their resources. And, placement advisors, we don't make any money off of the LTech clients. That's totally fine. I feel like, honestly, the clients that I get provide my income, and it fuels the fire for me to help the nonprofit or the pro bono or whatever you want to call it, the people I'm not going to get paid for. And I do a lot of that. I do a lot of reading out, and the tour this morning, this lady, this happens to me a lot, and I'm just being myself, and I'm there with my little lady Mary, and I fit her in before my podcast this morning because she's kind of in a situation she really needs to get out of, and I said, let's go. I'm going to pick you up, and we're going to go. And the tour guide of the community could not stop complimenting me on thanking me for helping Mary this morning. Thanking me because I told Mary, I said, don't you worry about it. I'll come and get the paperwork for you. You don't have to come back over here. Your sons work all day. You don't have a car. And she's like, well, you don't have to do that. And I said, no, I do. This is what I do. And I'm happy to. And that tour guide took my business cards and said, I want to refer to you. She said, I have placement agents come in here all the time, but she said, I'm picking you just because I could see the passion and the compassion and that I was this real person that actually cared. And that shines through. I don't have to fake it. It just comes, it's a natural thing that just comes along. So it's
I'm so glad you said that. That's like a full circle moment for me with this episode, because in the beginning when you were talking, I was thinking about that. I'm like, I wish more communities would be proactive and reach out to the placement agents and form those relationships, because it shouldn't just be about you connecting with them. They should have their go-to people that they know. 100%. If they've got vacancies, they can call you and say, hey, I've got, 3 units available in memory care or assisted living or, whatever. You can help them find some.
Well, yeah, that, but also what happens is they'll have residents or people that come and it's not the right fit for them. And so they'll call me and say, hey, we know we had a family come through. They're not going to live here, but can you help them? And that's huge for me. I mean, that's going to help me grow my business literally based on just what I've been doing my whole life, just being me and helping. But she said, she gave me a hug at the end and she goes, thank you so much for really caring. And I just thought, I was like, oh, well, thank you for noticing, because so much of that just gets unnoticed all the time, And I feel like it already is. It's starting to shine through, and I think I'm going to get leads just based on that, just off of the fact that I'm willing to go the extra mile, and drive across town and bring back the paper. That's nothing to me. You're 80-something years old on oxygen with a walker. Let me do that for you while I still can, That's why I'm here. So I love serving seniors. I get so much gratification. I get nonstop hugs and thank yous, and truly, I want to say it's almost like they're shocked to have somebody that's not charging them, that is willing to go out of their way for them. They have not seen that, and it's sad. There's just there's so much negative and hate and evil and scams that they're just so used to that, and they have that wall up, I tell you. Once they spend a little bit of time with me, they're like, oh my gosh, you're the real deal. Thank you so much, and it's my pleasure. I love it. So
that's why I love this industry. Just the people who are passionate about the work they do, it really shows and shines through. And there is no other industry that's even close to this, in my opinion. Yeah. So that's what made me fall in love with it.
I have a little joke to tell you. I was joking around with my mom the other day. I said, I'm doing all these great things, and I'm out to lunch with 80-year-olds all the time, and my mom's just always laughing at me. I said, yeah, but at my funeral, there's not going to be anybody there to tell all the great stories. I said, all my friends are 80 and 90 years old.
Yeah. That's so true.
I said, they'll have to write me some letters that you guys can read later.
Yeah, your eulogy. That's great. Looking ahead, the future of senior placement, what do you see as the biggest challenges and opportunities in the senior placement industry in the next 5, maybe 10
Like
years?
for me as a placement agent or for just all around?
Both, I say, for you or for senior placement agents in general.
I think the challenge is corporations, like a place for mom, honestly. But, I think for me, I think it's going to be huge for me because I offer such a different kind of service than a lot of people. I don't really know what the challenges are going to be for senior placement agents. I think that the challenges are going to be for people is affording the care. Some of these communities are just charging so much money, and there's no way that it takes $10,000 to take care of one person, and you've got 600 people in your building. So I really think that's going to be the challenge is for people to find affordable care. It's really getting hard out there. And I'd like to I really want to start a nonprofit that's going to have these resources, people that are like me that are willing to work for free for some of these people, maybe do some fundraising, have a budget for some of these that maybe they need help with the deposit to get in. I have so many people that live on Social Security and that's all they get. They don't have the other $3,000 to move into assisted living. I want to have some kind of organization that provides these kinds of funds for these 80 and 90-year-olds. Where are they going to go and get a loan, No one's going to get a 90-year-old alone. So I think that is honestly, it's just our economy and what the world's going to right now. That's going to be the biggest problem is finding affordable care, because people are raising their rates and finding good caregivers because, again, they're not paying them well enough. So I work with really great home care and really great hospice, but I have those people calling me every single company in the world wants the placement agent because they know we work with seniors, but I'm very careful with who I'll work with. I like the family owned. I like people that have been in business for a long time. I won't go to corporations anymore. I do the small mom and pops, private caregiving, things like that. So I really do think the challenges are just mostly going to be with everybody being able to afford. We don't know how the future is going to look for any of us right now. So,
I think the challenge is not so much with the placement agents, but with housing and with staffing of the communities themselves, just because of the influx in the number of seniors entering the market. We're so far behind in terms of development of communities that we need in order to have enough places for people.
Well, and did you know that, and I know here in Arizona, 2024, I was very slow. 2025, I have not stopped, and I am getting younger and younger people wanting to move in. So, and that's really interesting. There's a lot of people in their 70s, 75 that are going into these assisted living, and it's because the ones that are affordable, if you think about it, I can barely afford food for my family. So at these assisted living, that's all that one package. And so these seniors are finding the benefit for that for sure. The no bills, the housekeeping, the food's all included and everything. So yeah, just being able to find the caregivers to staff the places because the seniors, here in Arizona, we're at like 60% seniors here. So the other part's college and then the other part are my age. It's a huge industry here and we're seeing younger and younger moving in.
Yeah, it's a challenge everywhere. Just the silver tsunami, as they say, it's pretty overwhelming just to think about how we're going to fill that void. So I think that's probably going to be the biggest challenge industry-wide anyways.
Yeah.
But yeah, affordability of care too and communities, I think that's a huge one too, because you would think if there's more people in the market and there's more housing available that the price would come down because there's going to have to be housing available for the middle market of the United States. Not everybody can afford the $8,000, $10,000 a month. That's just not possible
I'm on
for
the east
most.
side here, and I'm in Tucson, Arizona, and so there's not a lot of east siders over here, which is good for me. But it's a little more affordable over here, so that's nice. I've got those options. But man, I tell you, those rooms go lickety split. That's why I got Miss Mary over to the place I went this morning because I'm like, your room's going to be gone by tomorrow, so let's go and see today.
Yeah.
So we jump on those opportunities, which is another reason why you should have a placement advisor because those communities do call us and let us know when those rooms open up.
That's true. All right. So my last question for you is how can our audience stay connected with you and learn more about the right senior care connections?
Yeah. So I've got my website and that is the rightseniorcareconnections.com. And so I'll be this year I'm going to be doing a blog and a lot of education and just some fun stuff. So you're definitely check out my website. And if you need any more information, even if you're not in my state, I'm more than happy to just chat with you. Put your information in my website. It's all free. I love to talk and I know what I'm doing. I've done it for so long. So I would love to just answer questions and, maybe quash some fears that you have about senior living. So yeah, that would be great.
That's great. Love that. Well, as we wrap up today's episode, thank you so much, Jamie, for such a great conversation. Thank you for sharing your expertise in senior placement, dementia care, and financial planning. Your personalized hands-on approach to guiding families through this difficult process is exactly what the industry needs. So if you want to stay connected with Jamie Slone and learn more about the Right Senior Care Connections, visit therightseniorcareconnections.com and follow her on LinkedIn. And again, we'll put all that in the show notes for you. So as always, we hope you found this episode insightful and inspiring. Don't forget to subscribe to our podcast on your favorite platform and stay tuned for more episodes where we continue to explore the evolving world of senior care, covering everything from innovative care models and leadership strategies to family support, technology, and the future of aging. Also remember that From Leads to Leases isn't just an audio experience, we're also a video podcast. So if you want to see video versions of our episodes like the one here with Jamie, make sure to subscribe to our YouTube or Spotify channels. I'm Jerry Vinci, CEO of CCR Growth. Thank you for joining us on From Leads to Leases, and please like, subscribe, and share this episode with anyone who might find it useful. I'm truly grateful for your time and attention. Until next time, lead with strategy and with heart. Chat with you again soon. Thanks,
Bye-bye.
Jamie.
Thank you.
Thanks for listening to From Leads to Leases. Are you ready to fill your rooms faster and increase occupancy? Visit ccrgrowth.com to learn about our Senior Growth Innovation Suite, a proven system to generate highly qualified, tour-ready leads, accelerate sales, and reduce acquisition costs. Let's connect and turn your challenges into opportunities. See you next time.